Welcome to our channel. I bet you didn't know how common nosebleeds are. Nosebleeds can strike at any moment. Imagine this. You're going about your day, maybe walking outside or working at your desk, when suddenly you feel a tickle in your nose, almost like a feather brushing against it, followed by a warm trickle that catches you off guard. You look down and see bright red blood on your hand. It's a nosebleed. Nosebleeds, also known as epistaxis, can be alarming, but they're usually not serious. They can happen to anyone at any time. Most nosebleeds are caused by minor issues like dry air or a slight bump and can be easily treated at home. Nosebleeds happen when the tiny blood vessels inside your nose break. These vessels are very delicate. These blood vessels are very delicate and close to the surface, making them prone to rupture from even minor irritations. While anyone can get a nosebleed, they are more common in children and older adults. But don't worry, this article will guide you through the common causes of nosebleeds, how to stop them effectively, and when it's important to seek medical attention. Knowing this can help you stay calm. We'll also share some interesting facts about your amazing nose and its functions. Let's take a peek inside your nose. The inside of your nose is lined with a moist, delicate membrane called the mucous membrane. This membrane is full of tiny blood vessels that help warm and humidify the air you breathe. One particular area inside your nose is prone to bleeding. It's called Kieselbach's plexus, and it's located on the septum, the wall that divides your nostrils. Kieselbach's plexus is a network of blood vessels that is particularly fragile, making it a common site for nosebleeds. Because the Kieselbach's plexus is so superficial, even minor irritations or dryness can cause the blood vessels there to break. This is why nosebleeds are so common, especially in dry climates or during the winter when the air is drier. We now know that nosebleeds happen when the blood vessels in our nose break, especially in the Kieselbach's plexus, a network of vessels located in the front part of the nasal septum. But what causes these blood vessels to rupture in the first place? This is a question many people ask when they experience a nosebleed. Well, there are several common culprits that can lead to this issue. Dry air is a major offender, especially during the winter months when indoor heating is used. When the air is dry, the mucous membranes in your nose can become dry and cracked, making the blood vessels more susceptible to bleeding. Using a humidifier can help maintain moisture in the air. Nose picking is another common cause, especially in children who may not realize the damage they are causing. Picking your nose can irritate and injure the delicate blood vessels, leading to frequent nosebleeds. Allergies can also lead to nosebleeds as they cause inflammation and irritation in the nasal passages. When you have allergies, your nasal passages become inflamed and congested, putting pressure on the blood vessels, which can result in bleeding. Other causes include colds, sinusitis, high blood pressure, and certain medications, such as blood thinners, which can make the blood vessels more fragile. While most nosebleeds are harmless and can be treated at home, some can be a sign of a more serious underlying condition that requires medical attention. It's important to be aware of the potential causes of your nosebleeds so you can seek appropriate treatment if necessary. Always consult with a healthcare professional if you have concerns about frequent or severe nosebleeds. Experiencing a nosebleed can be unsettling, but knowing how to stop it quickly can make all the difference. Nosebleeds are common and can happen to anyone, often without warning. Here's a simple guide to help you handle those unexpected nosebleeds. Step 1. Stay calm. Keeping your composure is crucial in managing the situation effectively. It's important to stay calm and reassure yourself or the person experiencing the nosebleed that it's usually not serious. Most nosebleeds are minor and can be treated at home. Panicking can elevate heart rate and worsen bleeding. Step 2. Lean forward. This position helps prevent blood from flowing down the throat. Contrary to popular belief, tilting your head back is not recommended as it can cause blood to flow down the throat and potentially lead to choking or vomiting. Leaning forward is safer and more effective. Instead, gently lean forward to allow the blood to drain out of your nostrils. This helps keep the airway clear and reduces the risk of swallowing blood. Step 3. Pinch your nose. This is a crucial step in stopping the bleeding. Using your thumb and index finger, firmly pinch the soft part of your nose, just below the bony bridge. This area is where most nosebleeds occur. Maintain constant pressure for at least 10 to 15 minutes. Be patient and resist the urge to check if the bleeding has stopped too soon. This helps to compress the blood vessels and promote clotting. Consistent pressure is key to stopping the flow of blood. Step 4. Breathe through your mouth. This ensures you can still breathe comfortably while your nose is pinched. While pinching your nose, breathe slowly and deeply through your mouth. This will help you stay calm and maintain oxygen levels. This will ensure you are getting enough oxygen. Deep breaths can also help you stay relaxed during the process. Avoid blowing your nose for at least 30 minutes after the bleeding stops, as this can dislodge any clots and restart the bleeding. Give your body time to heal and form a stable clot. Prevention is always better than cure, and this holds true for nosebleeds as well. These are the key tips to prevent nosebleeds. First, maintain a humid environment. Dry air can irritate the nasal membranes, making them more prone to bleeding. Using a humidifier in your home can help keep the air moist. Avoid nose picking, a common cause of nosebleeds, especially in children. Encourage using a tissue or a gentle nasal spray to clear the nostrils. Staying hydrated is crucial. Drinking plenty of water helps keep the nasal passages well hydrated. Lastly, avoid environmental irritants like smoke and strong chemicals. By following these tips, you can reduce the chances of experiencing nosebleeds. If you found this guide helpful, please subscribe to our channel, like this video, and share it with your friends. Stay informed and stay healthy.